patient would have to show signs and symptoms consistent with COVID-19 in order to qualify for a test. Those symptoms range from fever, respiratory symptoms, other flu-like illness symptoms such as body aches and chills. There are other minor criteria such as recent travel, perhaps exposure to someone with the virus that would bump up a person from a low likelihood to a higher likelihood of having the disease. So it's really the constellation of those symptoms and the story behind which the person is presenting that qualifies someone for the test. The tests themselves take approximately 72 hours to come back if it's done via the traditional nasopharyngeal or oral route. The new saliva tests that are being produced actually can be resulted within 24 hours, and they don't require a nurse or a medical professional to administer them to you. They can actually be self-administered. So those are the two options at the moment that we have, the traditional tests and then the newer self-administered tests. The labs at the moment, and this is a little bit up in the air because I think the government is pushing back on the labs a little bit, they're charging anywhere from $50 to $200 for the actual testing equipment. Other providers are charging for delivery and other aspects around the testing, but the kits themselves range from $50 to $200. Now you might hear about free testing, and that certainly is the case with those that are in dire need. So those at hospitals or other settings where there's a medical concern, those tests are being offered for free. In general, keeping your immune system at the highest level possible is the best prevention for the disease. And that means getting enough sleep, making sure that you're not doing things that hurt your immune system like smoking cigarettes, drinking alcohol, anything which generally is not as good for your healthy immune system. You can also take over-the-counter vitamins like vitamin C, zinc, or glutathione. And then lastly, there are some medications now that are being studied in response to COVID-19, such as Plaquenil or hydrochloroquine. It's a medication that's been out there to boost people's immune system when traveling to endemic areas in Africa for malaria, for example. And now we're starting to study that medication to see if it has benefits in preventing people from getting complications of COVID-19. This was a medication that was used a decade ago in the SARS epidemic, and now we're just starting to see if it can be helpful for this current pandemic that we're in. Yeah, I think, as I mentioned, just general precautions for your immune system. So over-the-counter vitamins, zinc, vitamin C, B12, glutathione are really helpful. Washing your hands, trying to avoid public gatherings. But if you do have to be in public, wearing gloves or masks or, to whatever extent is possible. And then, just other things for a healthy immune system, making sure you get 8 hours of sleep a night, trying to reduce alcohol intake and smoking cigarettes, trying to eat a healthy diet. These are just generally things you can do to stay healthy. My company is called Concierge MDLA, so you can find us online at www.conciergemdla.com. You can book a house call or an in-home test on the website.